Thank you for joining us today. A lot of changes going on in healthcare, and with an update on things such as a hospital addition and what's going on at your hospital in the Brattleboro area. Brattleboro Memorial Hospital President and Chief Officer Steve Gordon. Nice to see you.
Great to be here.
Thank you.
Look forward to it.
Now, the one big thing pending at BMH, an addition which, of course, part of it includes the moving of the MRI machine to more permanent headquarters. The other part includes a renovation and expansion of the emergency department. Maybe just a quick word about what the timing is on all of that.
Well, hopefully this fall we'll have groundbreaking for the new emergency department. You know, Tim, it's been 30 years since the hospital last had any kind of major work done to the ER. And in 30 years, the volume has grown twice. 30 years ago, 1982, was the last time the ED was really touched by human hand, and we were seeing about 6,000 patients a year. Now we're seeing over 13,000 per year. So we've doubled the volume, and in the same amount of square feet that we had in 82. So, and it's about 72% of all of our patients being admitted through the emergency department. We really needed to put a lot of effort into a whole new ED and an expanded ED.
So really, the face of medicine is changing. People are coming in for shorter stays, and the circumstances which they come in for have changed.
Oh, dramatically. So much of what we do now is outpatient. And what you find now is those 1 or 2 length of stays really don't exist anymore. It's really a sicker population now, except for things like OB, which is still a very vibrant service at the hospital. So the ER really is the portal of entry for the sickest of patients. And that's why you see such a high percentage of the admissions that we have come through that emergency department.
And of course, same-day surgery was most recently upgraded. Between those two areas, that is a lot of the volume that goes through your doors.
Oh, absolutely. Absolutely. And, you know, I've always looked at an emergency department, really for any hospital, as that's your front door of the hospital. In many, many cases, the ED is the portal of entry into the healthcare system for people new to the area who might not have a physician, or for those folks who don't have insurance. That is where they can come in and be treated without fear of being turned away. So the ED is a vital, vital link for the healthcare services in our community.
While what's going on in healthcare in America means that the emergency room is your front door, what happens once you see people the first time? Is there a way to get them to do what really is the norm nowadays, to find a primary care physician and try to work out some care that would be more affordable for them and for the system?
And to keep them out of the ER for future visits.
Right.
Absolutely. And you know, Vermont is really taking a lead in the nation in terms of creating what we term medical homes. We already have 2 practices in our community, Wyndham and Family Practice and Brattleboro Primary Care, that have been deemed medical homes. And all of the BMH practices, primary care practices, will become medical homes within this next year. And what that means is patients who are associated with those practices will get additional services, not just what the physician provides, but we'll have dietitian, we'll have diabetes education, we'll have a health coach, we'll have a mental health counselor. And gentlemen who you know, Richard Davis heads up our community health team, and that's under the auspices of Wendy Cornwell at the hospital. So with the intent of trying to reduce those future admissions or visits to the emergency department, and really treat those patients in a better manner, in a less intensive environment.
How much of that is driven by cost, and how much of that is driven by a desire by the patient to stay healthy for longer?
Well, I'll tell you right now, it's really driven by the state and by the focus at trying to reduce costs and reduce the incidence of follow-up visits to an emergency department, which could be seen in a lower cost environment. So that's kind of where it's really been driven, and it's really the right thing to do, because the ER is a great place for episodic visits, but it's not the best place for ongoing continuous care, for your own health care.
No, in fact, if you look at the cost of running an ER, it's much higher than the cost of running a family practice physician.
Oh, it's 24/7. You come in, you see the nursing staff, the administrative staff there. It's probably one of our most costly endeavors in the hospital. But it's a critical service, and you've got to have the service.
True, but it's not the kind of thing you want people to come in for events that may not be really a 24/7 emergency.
Yeah. But, I've been in this field a long time, and you're never going to stop that from happening, because people also want convenience of going into some place. Let's say, they can't get in to see their primary care physician, or something else occurs and they need rapid treatment. One of the things we are doing with the new emergency department is we'll have 2 rooms for just that, for urgent care rooms. They'll be staffed predominantly by a mid-level or nurse practitioner or a physician assistant, and hopefully those patients that will be triaged to those rooms, which is really in the front of the hospital, in the front of the new ED, for a lower cost and for a more rapid treatment, and hopefully get them in and out within 30 minutes. That's one of our goals.
Wow. Has there been given any thought to running medical practices that would be more than just 9 to 5, since it seems like the ER becomes a catch-all in the off hours?
Yeah, we actually have pediatrics has extended hours. Pediatrics has Saturday hours, so we do have that for a number of the practices. I don't think there's a big appetite on behalf of the physicians to try to do extended hours for their practices. What they will try to do is work patients in as much as they can to their existing schedule.
That does make sense, and really, how much responsibility for one's care rests on the community and the doctor, how much rests on the individual?
Well, and that's one of the things with the medical home concept, is trying to educate patients as to what's best, in terms of lifestyle, in terms of food choices, fast food, versus farm-grown food. So we do, as part of the community health team, we do have a lifestyles coach who, that's one of her roles, is really helping with that. And it's a huge issue. We have a huge problem, a bubble coming up with childhood diabetes in this country and in this area. And that is going to be a major cost driver. So we've got to have some tools to intervene and provide better education for both the adults and parents and the kids.
Is diabetes and obesity the major issue that is really hitting healthcare these days?
I think absolutely. I think heart disease has always been up there, but I think when you talk to the physicians in the community and the staff, the issue of obesity is a real critical one.
So, and really, some may say that it may not be the person's fault, or is it? And how do we find a way that is both helpful and respectful to all involved?
Yeah, that's going to be beyond me, but and that's why we have the community health team members to really work. And you got to break it down to the individual level and connect those people with the right resources, which I really do believe that Vermont's going in this right direction in terms of creating these medical homes. Richard Davis and his staff have gone into patients' homes, gone through their cabinets and identified, hey, you have some very high sodium content vegetables here in terms of canned vegetables, you might want to look at doing something a little different. So it's one person and one family at a time. I think that's where it's going to come.
Yeah, I was talking with a friend out at an event the other day, and I guess the phrase is, "I wish I didn't eat now what I shouldn't eat then," or something like that. Golly. So really, it's going to take a lot of us to change some habits, change some behaviors, and the medical profession to be understanding.
What's going to be very interesting, too, is you can take this up a level, too, because our whole healthcare system from a financial standpoint has been built on episodic treatment and paying for that episodic treatment. You come in for an appendectomy, you come in for a knee surgery, you come, whatever you come in, you get, we get paid for that piece. Where we're heading in this state and movement in the country is really called population-based health. Really taking the not just the episodic care, but looking at the whole spectrum of healthcare. And that's why I look at Brattleboro Memorial Hospital, BMH, not just as a hospital, but we've got to migrate ourselves to a healthcare system. That's why the community health team is so important. That's why interfacing with all of the great agencies within Brattleboro, dealing with health, dealing with well-being is going to be very important. Dealing with our peers at Grace Cottage as well as our folks at the retreat. So it's going to take a village.
That really leads me into the whole matter of health education. A first ever joint health event with the 3 healthcare organizations in this county. How come?
Well, I sat with Wendy Cornwell, who's been involved in healthcare probably for 20 years or so. And I said, I think we've got to be more collaborative. We've got to be more open. And, we've got some great resources, and the communities have great resources with the retreat and with BMH and with Grace Cottage. Grace Cottage stopped doing their health fair a couple of years ago. They just didn't have the attendance. I said, Wendy, you've done a great job. We've had a great attendance in prior years. Let's see if we can take it up a notch and really look at involving the other hospitals and other healthcare providers. So I'm pretty excited about it because we're going to have the nursing homes present. It's going to be a pretty much all-inclusive health fair coming up on the grounds of the retreat.
And that, of course, is scheduled for the 22nd of September on a Saturday. Yeah. Look forward to that. Something that's been going on in the Brattleboro area, a lot of the longtime physicians have started to retire, and change, as they say, is good, but it also begs the question, is the next generation out there, and do they want to come to Brattleboro?
Yeah. Well, I think you and I met a couple of weeks ago in my office, and we were talking about that. I looked at some numbers. We had, I think, 13 physicians retire since 2001, and we had a phenomenal reception for retired docs and retiring physicians at the Putney Inn a couple of weeks ago, and where we brought back, there had to be 15 to 30 physicians, and these are physicians that not just retired this year, but physicians that have retired 13, 14, 15 years ago, who this was an opportunity for us now to recognize them. So it was a great opportunity. But these are physicians that came here, hung up a shingle in the 70s and 80s, and just started practicing. And the world has changed. Physicians can't do that anymore. The cost of opening up a medical practice is astronomical in terms of your malpractice, the business acumen. You have to now have computers. It has changed dramatically. So what we're seeing now is physicians who are coming out of their medical education with $150,000, $200,000 of debt. They don't want to take a risk or take on big bank loans to open up a practice. So what they are doing is they're looking at hospitals like ours to employ the physicians. And we now employ up to 30 physicians in Brattleboro, and that's both primary care, family medicine, internal medicine, pediatrics, general surgery, OBGYN, midwives. So we've really, in the last several years, really now built that physician enterprise and the ability to employ physicians. In terms of recruiting physicians, this is a great area to recruit for. Brattleboro is a highly desirable area. You're not going to have physicians come here that are going to want to make a fortune. Okay? They're just not coming to Vermont because Vermont physicians, by and large, make substantially less than physicians across the borders from us. But you have a certain cachet, you have a certain lifestyle, you have a certain vibe of this community and other communities in Vermont that physicians want to be a part of. And that term community is really important because a lot of physicians that I've recruited over the last 2 years of being here, they really thrive on that sense of community. They're very interested in that. Plus the physicians coming here, have a penchant towards healthcare reform. And this state, probably more than any other state in the union, is really taking healthcare reform to heart. And the Green Mountain Care Board is really looking at a lot of different alternatives to reform both how we are financing healthcare as well as how we deliver healthcare. So for a lot of physicians, they want to be part of that. A lot of physicians don't want to be part of that because it's kind of scary, and it's scary for everybody in healthcare too in Vermont because of the unknown. But Vermont's kind of a crucible of experimentation in terms of healthcare reform, and that's a pretty exciting thing.
Have the changes made by BMH among those acquiring the physician practices and repositioning what it does, have they put you on the cusp of being able to see the future?
Yeah, I think the hospital was probably one of the last hospitals in the area to really start employing physicians. And that goes back to the strength of its medical staff who came here in the 70s and 80s. But now it's a reality. We have to employ physicians to give them that security of coming here. But, I think if we're to have a vibrant hospital, healthcare community, that's the model we have to go with at this point in time.
Then what's the next step? Is there further collaboration coming down the pike, and will we all just go to something called healthcare?
Well, I think what you're going to see, and I think you'll hear more in the coming weeks, is larger systems being put together. And I'm not talking about asset mergers. I'm not talking about Brattleboro merging with another hospital. But we have to develop relationships. And I think that's one of the things that, especially as we look at this population-based type of healthcare, that we're not going to be able, as Brattleboro Memorial Hospital, on our own, take care of the 50,000 people in Windham County. We need to be part of a bigger system. And I think what you're going to see is more collaboration with Dartmouth, Hitchcock, which is our tertiary referral source, as well as Fletcher Allen up in Burlington, and the community hospitals, forming a partnership to look at healthcare of the future and how we're going to render healthcare of the future. And I'm not talking about us giving up our independence, but I think we're going to be talking about how best to care for our patients, continuity of care, best practices, protocols, care protocols. What's best evidence-based medicine. So that's where I think we are definitely heading, and you will see, I think, a growth of larger systems of care. The government's putting that out right now, called accountable care organizations, where they're taking populations right now, Medicare population, and putting it out for an ACO, an accountable care organization, made up of hospitals to care for a population. And we'll be part of that here in Brattleboro. So I think that's one of the futures. There's not just one future. I think the government, both here in Vermont as well as the feds, are looking at a couple of different avenues of healthcare of the future, and that being one of them.
Where does competition fit into all this? Will there still be competition, and who will your competitors be?
Boy, 5 years ago, I think everyone had on this competition hat. And I think not so much in Vermont, because Vermont was pretty unique. You have 13, 14 hospitals. in fairly geographically isolated markets. That you might have nibbling of service areas, at the edges, but fairly well defined community hospitals, because that's where you have your communities. And at 650,000 people in the entire state, there's not that much to compete for, to be honest with you. You go across the border to Massachusetts or New Hampshire, where you have 2 hospital communities. There's a lot of competition there, and you've seen it through a lot of building programs, new services, things of that nature. The medical arms race. I think because of who we are in Vermont, we haven't seen that. We will see more collaboration because it's too expensive to compete. Where we have to show our competition is on quality of care. So that's where I think we'll compete, is the best quality of care, evidence-based medicine, as opposed to when you think of hospital competition, you think of big buildings, open heart programs, open heart surgery programs. We're not going to do that at Brattleboro. But we want to make sure our patients and the community has access to some of the best programs. And I think that's one of the relationships we've developed and continue to develop with Dartmouth.
Is there something available people can see online or anywhere for that matter, which says where the good hospitals are?
Well, you can go online, Hospital Compare. You can go on the Brattleboro Memorial Hospital website, and you'll see our statistics as to how we staff or how we stack up with other hospitals. Consumer Reports had a recent article on the safest hospitals, and I think we were number 2 in Vermont. And Leapfrog, which is it's not an industry group, it's actually a business group, rates hospitals, and we were rated very high. So there is a lot of data out there. I think the question is, there's almost too much data, and how do you wade through that? But there is data out there, and we do have it on our website, and that's one of the things that always impressed me about Vermont, more than any of the other states I've been a hospital administrator, is the transparency in the state. And you can find those statistics in pretty much on everybody's website.
So how does someone weigh in on their own care and the future of some of the things we've talked about today?
I think one is the relationship with their primary care physician. Having that relationship, and then hopefully especially in the Brattleboro area, having the majority of our practices, primary care practices, as part of a medical home. I think that's for the future. But I think at the end of the day, it really does become that relationship you have with your physician, and a relationship that is based on equal footing, so that you're comfortable in asking that physician questions that you need answered.
All right. Well, again, the website is bmhvt.org. Steve Gordon has been our guest. Thank you a lot.
Thank you, Tim.
Again, you can be an active consumer, get in charge of your own health care, but don't treat yourself. Leave it to the professionals. This is Tim Johnson. Thank you for watching.